In this video, we will demonstrate a reverse total shoulder replacement for rotator cuff failure with wear and tear arthritis using a reverse shoulder replacement system. The rotator cuff is a group of muscles that are responsible for helping move the shoulder. When they are damaged and not reparable, loss of function occurs at the ball and socket joint of the shoulder, causing pain and dysfunction. The shoulder joint, or the glenohumeral joint, is between the head of the humerus and the glenoid cavity. The most reliable surgical option to relieve pain is a special replacement that switches the ball out with a socket and the socket out with a ball, also called reverse shoulder replacement. The surgeon uses a series of instrumentation to place guides around the shoulder to prepare the humerus. Once the guides are in place, the surgeon removes the damaged area with a saw. A metal plate is placed on the cut surface to determine the appropriately sized implant and to protect the bone during socket preparation. Attention is then placed on preparing the socket. A series of instruments is used to mold the socket into the shape of the implant that will be secured to the bone. The size of this implant is based on the patient's anatomy. A flat metal plate is secured to the socket with 3 screws. Remaining bone and soft tissue from around the plate is removed. A trial implant is placed on the plate to determine the proper size and fit. The metal plate on the humerus is removed and final preparation of the humerus is initiated. Final humerus preparation is carried out by placing a series of instruments down the canal in the bone to determine proper implant size and angle. Once the size has been determined, part of the bone is removed and smoothed out in order to place a trial implant. After the trial implant is in place, the surgeon places the socket onto the ball and assesses the stability of the joint with the implants chosen. After appropriate sizing, tension, and stability are determined, the surgeon will then remove the trial implants on both sides of the joint. Finally, the real replacement will be implanted with a ball on the metal plate and a socket that is attached to a stem that is placed into the humerus. This completes the reverse total shoulder replacement.
Your hip consists of 2 main parts that fit together like a ball and socket: the femoral head at the top of the leg and the acetabulum in your pelvis. A total hip replacement is usually done when severe damage from arthritis or injury has made it difficult to perform daily activities. During the procedure, the femoral head and acetabulum are replaced with artificial components called prostheses. An artificial hip prosthesis consists of a cup called the acetabular component and a metal stem called the femoral component. Your surgeon will begin by making an incision overlying your hip, separating the muscles and ligaments to expose the joint capsule. After incising the capsule, your surgeon will dislocate the femoral head from the acetabulum. He or she will remove any damaged cartilage or bone in the acetabulum, reshape the acetabular socket, and secure the acetabular prosthesis in place using special cement or screws. Turning next to the femur, your surgeon will remove the femoral head, shape the remaining femur to fit the prosthetic stem, and secure the femoral component using cement or other techniques. Once both components are firmly in place, your surgeon will slide the prosthetic femoral head into its acetabular counterpart, test the movement of your new hip joint, and verify that it is properly positioned with an X-ray. Your surgeon will then close the joint capsule, repair the muscles, place a drain in your hip to remove excess fluid, and close the incision with stitches or staples.
During a total knee replacement, your surgeon will replace your knee joint with a prosthetic knee. Bones in the knee joint include the lower end of the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. Smooth cartilage, called articular cartilage, covers the bony surfaces, cushioning the knee joint and allowing the parts to move easily. The most common cause of knee disability is osteoarthritis, which causes the articular cartilage to wear away, resulting in severe knee pain and stiffness. When pain medication and other treatments are no longer effective, your surgeon will perform a total knee replacement. During the procedure, your surgeon will remove the damaged cartilage and bone and reshape the bony surfaces to fit the prosthesis or artificial joint. Your surgeon will cement up to 3 prosthetic components into place, including a metal femoral shell, a metal and plastic tibial component, and a plastic patellar component. Before closing the incision, your surgeon will bend and rotate your knee to ensure it functions properly. Over 90% of patients experience dramatic pain relief and improved knee function and have a new joint that will last 10 to 20 years.
신뢰받는 병원, 존경받는 병원, 행복한 병원, 진주 고려병원.